Good afternoon. I'm Dorsey Griffith with the UC Davis Comprehensive Cancer Center, and welcome to this Facebook Live. We are so excited today to have two amazing tobacco cessation experts here. First, we have Dr. Eliza Tong. She's an internist here at UC Davis Health, and she's also a tobacco cessation expert and internationally renowned researcher. And next to her is Terry Wolf. Terry is an RN, a registered nurse, and she has been taking care of cancer patients for many, many years here. She also is now the program manager for our new tobacco cessation program, which is, by the way, funded by the National Cancer Institute. It was a moonshot grant, as I understand it, and several cancer centers throughout the country have this funding now to really try to help cancer patients quit using tobacco. So welcome. Dr. Tong, I'd like to start with you. If you could talk a little bit about the effect of tobacco use on patients that may be going through cancer treatment, and really the effect of tobacco use on cancer.
Mm-hmm. Well, a lot of us have heard that smoking causes cancer, and in fact the Surgeon General now has expanded that list to 14 different cancers. So we know that already in the general public, but for cancer treatment specifically, it's so important when you're undergoing your cancer treatment to be aware of preventing secondary cancers, but also for the cancer that you do have, as you're undergoing surgery or radiation, it may take longer to heal if you continue to use tobacco products or be exposed to tobacco. And also in terms of medications for your cancer care, chemotherapy or pain medications, all those chemicals in smoking may actually affect the metabolism or how well those medications are part of your cancer care.
So does that mean that if you continue smoking or using, say, you have a mouth cancer or throat cancer, you continue to chew tobacco, does that mean that you might have a poorer chance of survival?
Yes, it may affect your chances of survival. It may also increase your complications from your cancer care. So this is something that we want to encourage patients and providers both, that this is something to take charge of now. This is an integral part of cancer care, not just something that's a bad habit or that maybe you should take care of at some point in your life. This is an integral part of taking care of your cancer now.
Okay, thank you. So Terry, quitting is hard. And we know that it's probably much harder for someone who's just been given a cancer diagnosis, maybe even, they've been given a cancer diagnosis, they smoke, and the smoking might have caused that cancer. I'm trying to imagine what that would feel like for somebody. Have you had experience talking to those patients? What are they going through?
Oh, I absolutely talked to many patients, and they're feeling some of the guilt and shame attached to this addiction to smoking, and in light of a really difficult diagnosis and coming up in a very stressful time. And smoking maybe has been the way they use for stress relief, and so that complicates it. But it's still really, really important, as Dr. Tong mentioned, that we not smoke so that we get the best out of your cancer treatment. And even though it's a stressful time, it's really the time to quit. And when you're first diagnosed, there can be a little bit of time as appointments get scheduled and your plan is all figured out. And that's a really good time for the patient to be like, this is the thing I can do for myself. Or a family members as well can say, I'm going to quit because I'm going to be around someone who has cancer. Mm-hmm. So they can all work as a team, especially if there's a household of smokers. So this is the time we can quit. I can do this for myself. I might not be in control of my schedule going forward with all these treatments, but I can do this. I can make myself as well as possible to get through my treatment, because you're here at UC Davis for the best treatment, the best cancer treatment, so you want to be able to get everything out of it.
So what are some of the benefits, I guess, to quitting? Even if you've been using tobacco products for 30, 40 years, as I'm sure many patients have.
Well, we know that there's benefits immediately, like within 20 minutes. As the tobacco products leave your bloodstream, your lungs better, your circulation is better. So even over days as you quit, there's a benefit to that quitting. Even if you've smoked for decades, there's benefits. So you want your heart and your lungs and everything to be, your body to be in its best shape possible as you start your cancer treatment. So this is one way to do it, to stop smoking at the very minimum, cut way back.
Does the research support this? I mean, it sort of makes sense that you would do better if you quit, but what do we know?
Well, now we know it for a fact. It seemed like the right thing, and I brought this little document around, and I'll show you how thick it is. But this is the research just on smoking for cancer patients. There's just pages and pages of scientific documents that tell us that it's very harmful to continue to smoke while you have cancer.
Interesting, thank you. Dr. Tong, so here at UC Davis, I know you're involved in many different tobacco cessation efforts that are global, but can you talk about what supports we have available to our cancer patients here at the Cancer Center to help them quit?
Right, so for any patient, there's usually medications and there's also counseling, and combined, the two of them help to increase the chances of quitting. So the idea behind medications is to replace that urge for smoking. So a lot of folks may already know there's nicotine medications, so patch, gum, or lozenge, or a combination of the two. And there's also nicotine inhaler or nasal spray, which sometimes you can ask for a prescription for. There's also 2 pills, bupropion and varenicline, which you can also ask your doctor for. So amongst those 7 FDA federally approved medications, clinical trials have shown those help people to make the behavior change to quit. So that's one part, and not everyone needs medications, but that helps to support it. The key part is to have an action plan to quit, and there are counseling resources for people to help prepare for those times when you feel that urge to smoke. A lot of folks think they can do it on their own, but it's those times of stress where you need that action plan in place to prepare for when you might need a cigarette. So the resources we have here at UC Davis, we have a wonderful health management and education program that through our Cancer Center grant, we've partnered with more closely, and we're now having the Cancer Center patients also get engaged with those classes. We also have the free California Smokers Helpline for folks who have maybe not the resources or transportation to attend a class. California Smokers Helpline has been around for over 25 years. They're operated by UC San Diego Cancer Center, where the counselors there are available at all hours, and they will directly call a patient and help walk them through one-to-one a 30-minute action plan, send them free educational resources for a booklet for themselves or their family members to work through. They'll do follow-up checks, check-in calls, up to 4 or 5. There's no other free state resource like it. So one of the program things that we've done here at UC Davis is that for the providers, we have now made it easy for them to enter in a referral order to the California Smokers Helpline. So if I see a patient and they say, yes, I'd like the helpline counselors to call me, I can just put in a referral order, and within 1 or 2 business days, a counselor will call my patient and send me back a result message. So I'll stay in the loop as a provider too. It'll help me with continuity of care.
So how do we have any results? Does this work well? Or I mean, is it challenging, or do people have to try it many times before they actually quit? What do we know about that?
Well, we know smoking is one of the hardest things to do, is to quit. But at the same time, we know that people making multiple attempts, and they say maybe 8 to 12 times on average for people to quit for good, we have to be understanding of that on both the patient side and provider side. And what I often tell my patients is to reframe what you think might be failure, but that you're trying again, and every time you try and just take a break from the nicotine or the smoking and that behavior, you'll be more likely to succeed for the long term. And often I tell folks, you didn't necessarily learn to walk the first time you tried as a little kid. This is something you have to unlearn and try again.
That's great. So Terry, how do patients learn more about these programs?
Well, one of the quickest ways to learn about our programs is the UC Davis Comprehensive Cancer Center website. And if you just go to the website, there's a tobacco cessation tab, and you can get all the information about the programs and the quit line. There's also a video up on the website that gives you a little bit of an idea of what it would be like to go through our programs. So you feel a little bit more comfortable about, we're not going to just take your cigarettes away and force you to quit, but that we do want you to give it the strongest of consideration as you start cancer treatment, because we really want you to get the best care, and that's how it happens.
And what about patient families? Because I know there's a lot of, when there's one smoker in the house, often there's 2 or 3.
Well, as we talked about, there's help for the family member as well. With the quit line, you can have that for family members. But Also, we offer free nicotine lozenges, which is a nicotine medication to give you the sense of smoking without all the toxins of the cigarette smoke. So the nicotine lozenges are available here at the Cancer Center for guests and visitors, and there's no charge. And you can inquire at the front desk at the Cancer Center to see where you can get those lozenges.
Great. And so Dr. Tong, you want to talk about the overall goals for this program? What do you hope to achieve over the course of this grant and this program?
Well, really for this program, we're excited to be part of this nationwide effort to have a culture change within all comprehensive cancer centers and beyond, because quitting smoking and other tobacco products is such an integral part of cancer care. That is a culture shift. It's never too late to quit smoking, and it's such an integral part of cancer treatment and getting the best outcomes for your cancer care.
Right. Well, thank you so much. We have no questions. If you have questions today and you'd like to send them along, please post them on this Facebook page and we will get... Oh, we do have a question.
So someone just asked how they can receive more information. We've linked to the website that you talked about in the profile. Is there any other phone numbers, or can they call the Cancer Center?
You can call the Cancer Center, and the number...
Right, you can call the main number at the Cancer Center, which I don't have on the tip of my tongue, but if you go to our website, all of the information is in a tab on the left-hand side of the website that says Smoking Cessation Program, and it will have everything you need there. We can also post, again, a phone number a little bit later today, so you will have access to that. And with that, thank you both so much for being here and for talking about this really important program at our cancer program. Have a great day, everyone. Thank you.
Thank you.